Hey everyone, Powell Shiau here. So last video we talked about what exactly is soft tissue, and we talked about muscle knots, how they form, and what are some possible treatment options for soft tissue therapy. Today, let's jump right into what the treatment options are. We're going to start with the most basic and the simple treatments that you can do right here at home, and as the list goes on, we're going to start getting into more advanced treatments that you can go see your medical professional for. So let's start with everyone's favorite. All right, your dog's favorite toy. A tennis ball can work, a lacrosse ball can work, any small ball can work. Find a spot that hurts and slowly move up and down the spot with the ball pinned against the floor or up against the wall. A hard surface works best, and allow your body to fall onto the ball and use the power of gravity to help with your muscle release. Then we got the foam roller. The foam roller is great for treating large areas and large muscle groups. Similar concept to the tennis ball and lacrosse ball. The more body weight you use, the deeper you'll dig into that muscle, the more it'll hurt. So lift your weight up slightly away from the foam roller during some of the more intense portions of the rolling. And the ultimate goal is to help loosen up the muscle. Another type of foam roller that's really good is the trigger point foam roller. Similar concept, but the only difference is the trigger point foam roller has these grids on it that help mimic the thumbs and the hands of a massage therapist, and these work wonders. Up next, we got something that's really popular right now. A lot of people love using it. We're not throwing this one. This one is known as percussive or vibration massage. You might know the company's Hypervolt. This one right here is an Allsafe. Either way, it works great. It helps take the pressure off your hands and your thumbs. It's all automatic. You just got to charge it, and then you can change the type of treatment head you use depending on the muscle group. You can change the time, you can change the duration, as well as the intensity. Kinesiology taping. You might know it as Kinesio taping. There are many different types of companies out there. KT tape, rock tape. It's really popular among athletes, and it works great. The premise is it helps provide a stimulus and cues your muscles through the right ranges of motion, and helps increase our body's proprioception or body awareness to the injured area. In addition to that, it can help relieve edema, it can help relieve the swelling to the area, as well as delaying fatigue, in addition to many other possible indications for taping, including TMJ, pregnancy, for other types of rib issues. You can see here, for instance, I taped my elbow as an example for tennis elbow. It works great because you apply the tape and then you leave it on for a couple of days. You can take this tape with you to perform in your competition, to go into your game. You can use this tape in the shower. You can use this tape when you're swimming, and you can use it when you're running a marathon, and it helps cue your body into moving through the proper ranges of motion. Cupping. So cupping helps create a local suction on the area of the skin. The skin is the largest organ of the human body, and what it does is the cupping removes the oxygen from the site, thus creating more of a vacuum effect, and the suction helps anchor the cup to the skin. Think of it as the opposite of massage. Instead of compressing the tissue, instead of pressing down, we're going to use the suction and the vacuum effect to help pull it up. Similar concept to the kinesio taping. You can see here on my arms I got a couple cupping sites just to demonstrate what cupping is like. Very comfortable. Let's move on to pin and stretch, or MRT, which stands for Myofascial Release Therapy. In this type of soft tissue treatment, we're going to keep a sustained pressure on the soft tissue area while we take the muscle from a shortened to a fully lengthened position, either actively or passively. And in myofascial release therapy, where our goal is to extend the fibers back to a more normal length. This is done with your hands, whether that be your palm or your thumb, or you can use a specific instrument like this, which acts as an extension of your thumb to help take the pressure off the joints of your thumb. And myofascial release therapy and pin and stretch techniques are really good at targeting specific muscles in very precise areas. Similarly, there's another type of treatment called PNF or PIR, which is an advanced form of doctor-assisted static stretching, which includes contracting that muscle group that's involved and targeting specific muscle groups. And overall, the goal of PNF or PIR is to regain normal range of motion within the joint. Perhaps one of my favorite soft tissue treatment options is IASTM, or Instrument Assisted Soft Tissue Mobilization. So with IASTM, the goal is to detect and treat myofascial restrictions or adhesions. If you remember, with MRT, we're working more so with the muscle groups. Now with IASTM, we're working with the fascia. Remember, we talked about how soft tissue is an umbrella term that includes any type of tissue that surrounds and supports structures and organs in the human body. Now this can include tendons, which connect the muscle to the bone. This can include ligaments, which connect bone to bone. And it can also include fascia, which is this connective tissue that helps surround the muscle and other structures. So with IASTM, we're going to use a single or double beveled edge of a surgical grade stainless steel instrument to help break up adhesions and increase inflammation to the local area. Now this is great at promoting microtraumas. The fibroblasts and other chemicals come to the site and help speed up the recovery period. It's also really good post-surgically to help break up scar tissue. This tool allows us to use more precision and less force when applying the treatment to the area. The ultimate goal is to remodel the unorganized collagen fiber matrix that's following an injury. Now let's talk about Gua Sha. So Gua Sha is similar to IASTM, but it's different in the sense that the instrument is not made with stainless steel, but rather it's usually made with jade. This particular one is made with the horn of a water buffalo. And the concept behind Gua Sha is rooted in traditional Chinese medicine, where you're going to scrape the skin along a very specific meridian or channel according to the principle and theory of Gua Sha. Gua Sha in Mandarin directly means to scrape sand, because as you scrape down the specific channels and meridians in the human body, you might feel a sandy or gravelly feeling during the treatment. And the goal of Gua Sha is to help bring out heat in the area. Finally, let's talk about acupuncture, specifically dry needling. So, no, I'm just kidding. It's not open. So the needles are very thin stainless steel sterile needles that are disposable after one-time use, and no fluids being injected with the needles. That's why it's called dry needling. So what is the goal of dry needling? Well, the ultimate goal is to really invasively get into that muscle knot or that specific hypertonic area and mechanically stimulate what we call local twitch responses, which is going to help break up those muscle knots. All right, so we talked a lot about the various types of different soft tissue treatment options, but the truth is there's a lot we didn't get a chance to cover, and pain relief is a lot more complicated than just treating soft tissue injuries. By going to your chiropractor, not only can the chiropractic adjustments help, in addition, they can prescribe you active corrective rehab exercises for you in addition to the passive modalities, some of which we talked about, some of which we haven't talked about. If you like the content, make sure you like, subscribe, and comment. There's a lot more great stuff coming up in the future. I hope you guys learned something today, and thanks for watching. Cupping.